Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh. Welcome to another Sangat Health TV show. And here, today we have my co-host normally, but today we're going to be getting some pearls of wisdom from you on health post-pregnancy. So why do people get depression? And first I'll introduce you. It's Dr. Kiran Sanghera. So Kiran, tell us about this postnatal depression. It's really something that's devastating for families.
It is, thank you. So postnatal depression is a condition which is actually getting more and more common now. It's being more recognised. So firstly, we have to acknowledge the fact that after giving birth to a child, a woman's hormones are very, very... we can cut this best out. A woman's... Yeah, they will...
They're out of sync. So you can't say they're all out of the place, but there's a big change that occurs through pregnancy.
Yeah. So the hormonal changes, which are occurring throughout pregnancy, it's still continuing actually after birth. So the initial period after giving birth can be very difficult in this case. So it's very common, if any actually is considered normal, for most women to have a baby blues, which is a milder version of postnatal depression. And it lasts for about a week. And it's when, mom feels very tearful, very overwhelmed, which is, as I said, considered normal given the huge change. So when it gets concerning is when these symptoms actually last longer. They're really, pervasive, and they're staying for at least a few weeks and up to months. Actually, postnatal depression is defined as depression which occurs within the year after giving birth. So there are multiple things to look out for. Okay, so we can all have an off day, but we're talking about here, low mood for at least a couple of weeks, feeling, your appetite can change, either reduced or increased, having sleeping difficulties, but obviously that biological sign is complicated by the fact that you're now caring for a newborn baby. And some women can also report, sadly, problems bonding with their baby, and they can even get quite negative and quite scary thoughts, sometimes about harming their child as well. So it's about really noticing when a thing's getting a bit more, it's not just quite baby blues, it's looking a bit more serious, a bit more concerning. She's seeming a lot more stressed and just very, not being able to cope with her emotions.
So here we are, the husband, the extended family. When they see this, how should they approach the lady who's gone through this kind of the pregnancy and she's suffering? How do they approach it in a sensitive way? How do they become convinced that she or help her to get to the doctors on time? What do we look out for?
Yeah, really good question. So I feel that the partners just have to be very, very present in being aware of this and picking it up, because they might notice changes that actually the mother doesn't notice. So just having that open, completely, from coming from a space of compassion and non-judgmental viewpoint of, how are you? Talk to me. So just very open dialogue. And once being able to engage in that conversation and knowing that there is no shame, there's no embarrassment. It's not saying that you're a failure or you're a bad mom, that you've been through this. So many women go through this, and there is help. So, being able to encourage her to come and see her doctor, or speaking to a health visitor, and just seeking help.
So in this country, we have health visitors. They come around and do their checks. But going to the GP, I suppose, for the UK is a first step. You book an appointment, you go and see them, or there's usually a practice nurse that can also support that. is there medication? Is it what kind of treatment is it? I think people get scared about depression. They don't want to be labeled forever with it, and there's a stigma. So that part of it, how do we help? I mean, do people come out of post-pregnancy blues, or is it forever?
So the majority of women can recover and will recover with a combination of treatments. So firstly, if it's on the more mild end of the scale, we will do what we call watchful waiting. So we encourage mom and family to do some lifestyle modifications. That's more rest, some gentle exercise, some mindfulness, eating healthy, just really focusing on recovering and having all that support around her. So when we start looking at cases which are more moderate end, GP or psychiatrist may want to start antidepressant medication. Now, there are some medications which can still be used during breastfeeding, but these will need specialist advice from the pharmacist and the doctor. And it's just knowing that actually it doesn't mean to be forever. It could just be a short-term input just to give you that extra help. So the antidepressants will help boost the chemicals in your brain to make you feel a little bit happier, a little bit less low, less anxious, and be able to cope. And the third thing is therapy. So there's something called cognitive behavioral therapy, which is very good in helping you understand your own emotions and giving you really good, effective techniques to use in the here and now about how to understand how your thoughts and behaviors all affect each other and how to break that cycle.
So Sangatji, this show again, I hope it's helped you to see that it is actually a condition. It is actually something that we should be watching out for after the lady gives birth to their baby. It's an important time to remain watchful, so both for the husband or the partner as well as the rest of the family, because there are certain telltale signs that will indicate that she's in trouble or she's having some challenges. The other thing we must remember is that coming from our culture, not long ago, well, in the time of Guru Nanak Dev Ji, children, when ladies were going to deliver, they used to go back to their mum and dads. And the whole issue was that that you're going to be looked after really, really well and pampered. And I think that, so that was where baby Nanaki came, and that's why she was called Nanaki, because she was born at the Nanake. There's a lot of love between them. And then Guru Nanak Dev Ji was the brother, but named after Bibi Nanaki. So again, in our history, in our traditions, and I'm sure in all traditions, there is this aspect that once a lady is giving birth and she has the child, to be in an even more supportive atmosphere is going to help baby and mum. And so maybe we should look into that as well, and if it's possible. But even if it's not, the family that she's in can become that supportive family.
As I say, it takes a village.
It takes a village. So thank you once again for listening. I hope you found that helpful. And thank you, Dr. Sanghera. That's a very helpful but succinct tips you've given. So thank you, Sangatji. Pass this on. Once again, wisdom, knowledge, it is only as good as it getting out there and getting put into practice. So please share this with your loved ones and keep tuned in with us at Sangat TV Health Shows. Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh.